Inner core muscles, the diaphragm. The purpose of the diaphragm is to breathe. Breathing is pretty important. 75 to 80% of all breathing is supposed to take place with the diaphragm. Diaphragmatic breathing, or lateral breathing as Joseph Pilates calls it, is essential for maintaining circulation for the blood to go to the muscles and keep them nice and active. So here we go, lateral breathing. You bring your hands to your ribs, or you have your clients bring your hands to the ribs. Notice my seating position, I am upright. My ribs are over my hips, and there's plenty of room for the diaphragm to go up and down. The diaphragm in a seated and standing position does not go out and in, it goes up and down. So you need to bring your hands to the ribs. And if your clients don't have enough extension, you can place your hands on their ribs, or you can place a gait belt underneath their breast line, put it a little bit firmly so that they're able to feel their ribs go out as they breathe in and loosen as they breathe out. So it's very important that they get some sort of feedback about breathing laterally, which is their ribs going up to at the sides like little pail bucket handles, right? Going up and down. Your belly, when you lay down, will naturally go up and down because your ribs are already going out to the sides when you're lying down. But it will not happen when you're sitting up or standing. So it's very important that they note this and they learn lateral breathing because, one, most of the breathing occurs, most of the gas exchange, the oxygen and carbon dioxide gas exchange occurs in the lower part of your lungs. Two, when they know that they have to breathe properly and get that lateral breathing, they know they have to sit up straight. When this slouch position, you're not able to get that lateral breathing, so that's a cue to you and cue to them that they're not doing deep breathing and deep lateral breathing. Another reason why it's really important to keep them aware of their breathing is that they can pace themselves. The movements that they should do should be precise. Remember, Pilates is more about precision and quality of movement over speed and quantity. So it doesn't matter if you do 5 really, really good reps versus 10 really poor reps. You're going to get maximum force usage when you have a strong base of support. You're going to have to use maximum muscle force for your lower extremities or upper extremities, and you'll be precise because you'll be doing things in breath time. So here we go. Your diaphragm comes from all the way under your ribs, right? And attaches onto itself a tendon that's created itself. It goes down and up. It goes down to fill up the lungs. It goes up to exhale out the air. Bringing your hands to your ribs, you can breathe in, and you should feel your ribs go all the way up to the sides, and then breathe out. Breathing in, and breathing out. Complete breathing, continue doing this, and I'll just briefly note that inhale, you go to the end of the inhale. And the exhale, you go to the complete end of the exhale. There's no pause. Joseph Pilates does not specify whether you breathe in and out through your nose. However, he was a yoga practitioner, and he as well also states in his books that you must breathe completely in and completely out. For this to happen, the best way for this to happen is breathing in through your nose and out through your nose. 2 things happen when you breathe in and out through your nose. 1, it slows down the breath. 2, it makes it a lot deeper. And then a real important thing of these deep breathings, what happens is the relaxation response, which makes Pilates a mind-body exercise program. The relaxation response is what happens when you do deep breaths, and it's the opposite of the stress response. Your blood pressure balances, your heart rate balances, your blood vessels dilate and relax, and there's more blood to your frontal lobes, which means enhanced attention, alertness, and concentration. So the deep breathing is for the muscles, the deep breathing is for awareness and attention, and the deep breathing is for, as well, good, nice oxygen exchange at the base of the lungs. All of this is exactly what's important. I'm just going to turn to the side here so that you can see that when I tilt my pelvis like this, I am not able to produce that lateral breathing, because all the muscles are contracting, going in this direction, pulling my ribs inward and downward. They're not allowing them to go up and out to the side. Plus, this is really heavy. My head's heavy, my upper body's heavy, and the diaphragm can't do what it needs to do. So you tilt your client's pelvises, make sure they're on their sit bones, and lateral breathing. Another reason for breathing in and out of your nose, remember, is also that you catch a lot of the mucus, all of the germs you catch from the mucus and hairs. Another reason why you want to breathe in and out through your nose is also the fact that your nose is especially shaped to grab maximum moisture from the air. Most of our clients are on a lot of pain meds which dehydrate them. The nose is shaped specifically to increase condensation, which is absorbing the moisture from the air to get more moisture and hydration into the human body. Another very important one related to the relaxation response is that your body produces nitric oxide when you breathe in and out through your nose. So your diaphragm is from down here, it's a giant dome, it's in 3 dimensions, it attaches to the spine, and when it is weak, you're not able to breathe. Your low back gets a lot of pain because it is being tugged at, right? The tight diaphragm tugs at that spine. And you're not able to get any of the relaxation response, which makes you heightened to pain and sensitized to pain. When stressed, we are more sensitized to pain. So let's do 3 more lateral breaths. Breathing in. And this video was Inner Core Muscles, the Diaphragm. Thank you so much.